Hi, everybody, and welcome to the HealingUs Podcast. Today, we're joined by Bill Spadea. Bill has an incredible career in media, and among a million other things, he is a jack of all trades and the voice of New Jersey for many, many years. He has been involved and an advocate for recovery, mental health, and just a voice of our industry on the radio and beyond. So welcome to the show, Bill. Thank you for joining us.
Thank you. It's great to be here.
And we also have Daniel here today.
Oh, Daniel's here.
Daniel's here.
Daniel is also here. Thanks for inviting me on.
Thank you for coming. So yeah, we're happy. We've been working with we've been speaking with Bill for almost a decade.
When did
now.
it start? I think it has been almost 10 years.
Yeah.
Crazy.
Right? And Rock the Farm's coming up.
The Farm is coming up. Yeah.
September?
June.
We had to switch.
We had to switch it.
We're
That's
just
right.
throwing everybody off.
It's on my calendar. I can't wait. Well, I mean, you think about it, just the fact that it's sad that you need to do it, but thank God there's so many people that show up.
Yeah,
Absolutely.
Every year.
Yeah, we're kind of excited to do it in the spring and seeing what that brings to us. Although, you know.
What's the record? 12,000 tickets?
Yeah, about that.
That was perfect,
realm.
yeah.
So, it's going to be huge. We're going to start pumping it out again soon to get our ticket sales up for this spring.
Yeah.
We're looking forward to it. And you'll be hosting, as
I
usual.
can't wait. Look forward to it. It's going to be awesome.
So I want to bring it back to the foundation, Bill. All those years ago. Obviously, I can't remember how we got introduced, but you've always been such an advocate on your show and just in general in your life and where you go for mental health and addiction. Why do you feel so rooted? What brings you to that?
So, I mean, there are a lot of things. Part of it is that when I got into the media, I realized how much lip service politicians and talking heads pay to important issues without ever uncovering a root cause. They want to, slap a Band-Aid on something and talk about it. And I watch how things progressed. A lot of politicians have made a lot of money and gained a lot of power talking about it. Yet year after year, New Jersey in particular, we are still way ahead of the national average on overdose deaths. And when the politicians started talking about Narcan, and I would go on, I've since I've been public with television and radio, I give a lot of speeches, I meet with a lot of different groups, and talking to the frontline folks, the cops, the EMTs, the people that are there dealing with now overdoses, and thank God they've got Narcan to save a life. But then you dig just a little bit deeper and you're like, wait a minute, I spoke to this group of EMTs a couple of years ago, and I asked them, I said, how many of you have administered Narcan? Of course, every hand went up. Every hand. I mean, there were hundreds, and I'm 800-900 people. And I said, well, how many of you have administered it in the last 30 days? About half the room raised their hand. And I said, how about the last week? I'm going to say maybe 150 hands went up. I said, how many of you have administered it twice in the same day? And maybe 65, 70 hands went up. And then I said, I'm not even going to ask the next question because I know the answer. How many times to the same person? And, hands still went up. I said, now think about a system that the taxpayers are paying to subsidize a life-saving drug, a life-saving, injection or inhaler, however it is administered, and the same person could go out and overdose a second time in the same day. It is beyond comprehension. So that idea, when I look at things that are that broken, you've got to fix it. So I'm blessed with a microphone that, the station that's got, I don't know, 1.5 million listeners. We're the largest audience in the state. And to me, it's about real people. I like people. I build a relationship with people. And when we all met, just the light bulb went off, that there's an opportunity to partner with people who are actually fighting against the same system that I'm fighting against. Yeah. This is not when we all started talking, this was not about money. I've seen some of these politicians and they set up this 1-800 line, and, a lot of the cases are referred to other states, and it's, you feel that there's a racket. I'm like, how could there be this much money being poured into a system and the same number of people that die in it every year, or increase it?
Right.
So that was a long answer to your question, but I'm just passionate about government should be about public service, and public service should be about serving people. And when people are dying, we are just, if they legalize pot, yet they go after flavored vapes, someone make it make sense. Right?
Well, legislation is one of those things that it never really makes sense. And it's like, who did you have at the table when you discuss putting this in order, and I'm all for regulation because there's always going to be people that try to take advantage of a system, right? And for selfish reasons. Yeah. And healthcare, it's profit, right? And so we need regulation to make sure, hey, those people, this is a business, but you need to do the right thing by the people that you're helping.
Guidelines. It's like a building code, right?
Which is great, but those guidelines should fit what is needed to be done for those individuals, not limit or make a lower standard for those individuals. Right. And a lot of this regulation that New Jersey put into play, which was all good and needed at the time, it also created a lot of a big wake in client care. Right. Mm-hmm. Right. So I've spoken to you about sober livings before. Right. And in 2018, New Jersey started putting legislation through to regulate sober livings. Totally 100% needed. There was a lot of bad flop houses that were taking advantage of people, getting them, making an environment where they relapse, essentially, or not caring about the environment, so they relapse, and then, getting those people into treatment, possibly profiting from that scenario. Right.
And there's
so that regulation needed
with people profiting. Like I've said this too. We have this. I don't know. For some reason, when you get into one of the most important aspects of our society, healthcare and mental health care and addiction recovery and all these things, how could we possibly expect that we're going to get good quality people in if they can't be profitable? Mm-hmm. Like I've always said this. Like this is the thing about whether it's police officers or nurses. You got to pay these guys. Mm-hmm. You got to pay them.
People go to school for hundreds of years.
Yes, and if you're not incentivized to have a better life for you and your family, well, you could do a million other things with your talent. And I've seen this. There's every family, and I've asked this in speeches over and over again. How many of you have been impacted by addiction? You don't have to be at a CFC event to have people raise their hands. Mm-hmm. Everyone knows someone. I mean, my uncle, my mother's brother, died of an overdose when I was, I don't know, maybe 11 years old, 12 years old. Mm-hmm. And what stuck with me is nobody really knew the extent of his problems. But people didn't talk about it. Right. Everything was hidden. Yeah. So the guy, this young guy, he was the youngest of four. And I remember how devastated my family was, my mother in particular, when they found out he was dead. And he died of an overdose. And he was living in Florida, and he had already lost his family. He was just kind of just a wayward guy. And I'm thinking, who stepped up to help this guy? Mm-hmm. 30 years old, or however old he was, young guy. And I was too young to really process that. But decades later, as I have my own family, I've got kids, and I'm like, wow, my Uncle Bill died, and nobody stepped up before he died to solve the problem. So now so to me, everybody has it and whether it's someone who drinks too much or does drugs, whatever it is, there are people that have control of their lives and they do stupid things. Mm-hmm. Then there are other people that really do suffer from mental shortcomings and mental illnesses, mm-hmm. and the structures, even beyond a stigma. I think most people are not equipped to do it. It's like you don't want a lawyer who represents himself in a case, right? That's the dumbest thing you can do. People need help, and there are people who are qualified to help other people. And mom and dad can take it so far, but I can't tell you how many parents. I mean, at every level in the last 10 years of dealing with the public, people will call desperate for help. I've had parents crying on the phone, whatever it is, whether their kid is stealing or the kid's doing drugs or the kid is just. And I thought, wow, we as a society need to look at the most vulnerable and the least among us and say, how much can we do? And that was, I think, the connection that we all made. Mm-hmm. And to your point, yeah, government has a role in setting up guidelines. The problem is government is setting up these guidelines without the two of you. Where are the stakeholders in the mental health community, in the addiction services community, mm-hmm. that sit on these boards? Right. How many people that think like you do and I do sit in our legislature? Very few. Mm-hmm. They can tell an emotional story about someone who died and they knew. I mean, Governor Christie would speak to this issue. But how much got done? How much really got done? Because as far as I could see, they set up an 800 line. They had a lot of good ads running, and people are still dying.
Yep.
Where are the people going? Right? Where are they being sent to? What kind of case management are you following those clients? And where are your success measures and all that? Yeah, and it really is a shame because as a small state that's very densely populated. We have access to a lot of great things here in New Jersey. That's what makes it an amazing state to live in. We're falling very short on public service in this realm. And, just dealing with government in general with all this legislation, and even what we deal with on the licensing front on how they regulate licensing for treatment centers.
How long did it take you to get your license?
It took me 26 months on the first one. And our second one that's opening in Toms River, Visa, we put in our licensing application in July 2023. We're sitting here in March 2024. I still don't have a license.
Amazing.
And it's an established place.
Yeah.
It's just an extra branch of what I already have existing. You've come and audited me numerous times.
Right.
Everything's good. I pass with 98 percentile every time you come in, and you're still holding me up. Why? What's going on? And then the person that comes in and is telling me if my facility is good or my policies and procedures are correct, just got put in that Department of Health before their mosquito control.
Right. It's a political job.
How do they regulate me?
Right. No expertise whatsoever. They have no idea. And how many people are dying every day?
Yeah.
Hundreds, thousands.
It's amazing.
And that's what's so frustrating because it's a perfectly beautiful furnished building, full staff, clinical team ready to go.
Right.
And they make regulation that hurts our client care. Like I was saying about the sober livings earlier, part of the rules that they put in there is that we're not allowed to provide services, but we have to have 24/7 supervision. So what is it, no services or no supervision? Because supervision is a service.
Right.
But under that service umbrella, I also can't do medication management. But I'm also forced to have people with MAT, medically assisted treatment. Those are controlled substances like Suboxone, methadone, stuff of that nature. So how do I regulate that with the other clients in the house to make sure that it doesn't get stolen or misused? How do I make sure someone with psychiatric co-occurring illnesses gets their psychiatric medication so they don't fall off the wheel?
Right.
I've been arrested to be able to do that. I can't do that. They want me to put them in the house and just forget about it.
Yeah.
And that's not real.
It's not serving.
That's not serving anybody.
Right. Well, you're making the problem worse.
Right.
Actually.
Yeah.
Right?
And so we need to do something, Bill.
We do need to do something. It's part of when we launched. So I took the radio show, and I mean it's the largest audience in the state, and then we decided that okay, the only way things function in New Jersey is through politics. Mm-hmm. That's it. You want to exist in New Jersey, you've got to exercise some influence in politics. And I tell people, ask me, they're like, well, you're sort of stepping out of the media and into politics. Why would you do that? I'm like, simple. Because the worse things get in New Jersey, the better my show does. The more money that comes in, the more ratings. And why? Because people like to complain, but also they like to know there's somebody that speaks their language and is listening to them, right? I tell people, I said, I've spent the last 8 years listening. I used to tell my kids this. You have 2 ears and one mouth. You should actually use them in that proportion, right? They don't always work. It doesn't always work with me. I try, though. I'm just saying. But the listening that I've been doing is, wow, we're in trouble. We're in trouble at every level. I was telling you earlier, I met with, we launched the Common Sense Club. We've got 150,000 members now. Fastest growing grassroots organization in the state, if not the entire region. And we've got 4 different organizations, a foundation, we've got an advocacy C4, and a couple of PACs. And I didn't know if it was going to work until we flipped the switch, and it worked gangbusters. And the reason? There's a vacuum of critical thinking. There's a vacuum of common sense. It doesn't exist. So one of the things we're doing is a Main Street tour. So every week I'm visiting a dozen or so businesses, and we do a walkthrough, and we try to promote them on the air. And so I'm in Oradell, and I'm meeting with pharmacists at Jay's Pharmacy, which is a local corner pharmacy. Been there, 65 some odd years. A staple, a foundation business in this nice community of Oradell. So he's struggling because with all the recent changes in the way the government pays out in Medicaid, et cetera, he can't fill a lot of prescriptions because the cost of filling it is more than what he would get reimbursed from the government. So he's sending people to these big chains. And then you find out it's all collusion. I thought we were opposed to this. You've got big companies. They're making the drugs. They're selling the drugs. They're prescribing the drugs. It's unreal to me. So to me, who speaks for Jay's Pharmacy? That's my question. Who speaks for these average people who are being swept under the rug? It's disgusting. And then in New Jersey, the soundbite is, hey, we made Medicaid available to more people. Well, that's a great soundbite. We spend $6.1 billion in Medicaid annually in this state. That was 22. Where does it go? 2.1 million people qualify because New Jersey changed the standard. It's now 133% of the federal number. So you have all these people. So your soundbite, your commercials, your ads look really good. People are dying.
Right.
Because your metric is a number. It's the same thing they sold us this bill of goods with insurance. They made the metric how many people have insurance. They ignored the healthy people with immune systems that are eating right and exercising who don't need a well visit every year, every 3 months, whatever it is, who don't need the drugs that they are prescribing for them. They leave that out. They're like, nope, it's all about a number. And the problem is when you're measuring it by how many people are covered, you're not talking about the quality of the coverage. Right. You're not talking about the quality of the service. So anyway, I like you guys are this incredible small business, which has really gotten much bigger. And this is where we should focus. And to me, this kind of your sober living, your treatment centers, this is the kind of thing that should be localized, where you can actually treat someone in the local area, get them the help they need immediately. Like we're politicians with Narcan. How are you not requiring a mandatory recovery stay? I don't know, 28 days, 20 days. I'm not the expert. If someone administered Narcan,
Immediately.
right? Immediately. We're not talking about incarcerating someone and making them a prisoner. You're saying we're going to force you to get help. Why? Because the taxpayers just paid to save your life.
You know
We
why
just
they?
saved your life.
You know why?
Yeah.
Because Medicaid won't cover their treatment stay.
Yeah.
Yeah,
And the bigger problem is those programs have been tried to roll out. We've attempted them as well. We do have successful with many police departments. But the problem is a lot of grant funding became available.
Right.
When that happened, then all of a sudden everybody wanted in on that program, right? And it got watered down and the care got worse. So it's a vicious cycle that we got to try to fix.
Actually, I'm glad you mentioned the police, because the police, I speak to a lot of union events. I spend a lot of time with law enforcement. We do Blue Friday every Friday on the show. We honor local law enforcement. And the reality is they're frustrated. They're as frustrated as you are, because they're the guys that are going out and confronting this stuff face to face. So you ask the average cop, is it good that we're trying to make it so that people are encouraged to call the police? Yes, that's great. But how do you deal with somebody who says, all right, thanks for reviving me. I'm now going back to the same party.
Right.
It's nuts to me. Your story, Daniel, which I'm sure you've told on this podcast before. I mean, your story was so amazing to me, about your mom, Lynn, coming across the country and finding you. And then to find out California got it right, where you could get the help even though you were an adult. That is the game changer. We need that here in New Jersey. We're not empowering parents. Like, how arbitrary. 18 to 20 or 17 to 18? How arbitrary. That kid needs help. I mean, our brains aren't even fully developed until we're 25. The experts say, as much as you can believe the experts these days. That makes sense with all the stupid things that young people do, and how many people in their early to mid 20s are suffering with addiction, fighting addiction.
Yeah.
It's amazing.
And addiction aside, I mean, we work primarily in mental health. And our adolescent program, I think, is a majority, especially post-COVID, a lot of mental health. And the insurance, most of them don't have it. I mean, 13 to 17, you're talking. And it's like, finding them that care. And New Jersey has come a long way in the recovery space in the last 10 years. But there's also, that report that just came out, which that's a huge issue.
You'd mentioned that. So tell me about it, just so I understand.
So SCI.
I know you sent it to me, but I haven't.
So
I want to understand.
So the SCI.
This is my cliff notes right here.
of New Jersey.
Spark notes.
Did an
I
investigation.
just aged myself. You're right.
Spark.
Yeah.
So they basically, it was an investigation into, obviously I think over the years, especially in the 2012 to 2015 realm, we had an explosion here in New Jersey with addiction treatment care. So I think we went from like 5 facilities to like over 300 over that time, and that list just keeps growing. So in lieu of that, there's a couple key people that stood out that, they mentioned in the report that we're doing not so good things, that we're, abusing the system and we're selfish in some of the moves that they made. So they did an investigation and into certain treatment centers and other nonprofits that basically they discovered some wrongdoings or what they felt were wrongdoings. It's an investigation, so there's no charges that are made, but there was a public forum where they, interviewed these individuals in front of a panel and whatnot. So, it came out, things that a lot of us knew were happening and been shouting from the rooftops that was happening. But you have RWJ Barnabas in that report. You have several treatment centers.
Big players.
You have a nonprofit organizations like community places, and basically taking advantage of individuals and getting paid for that, but not in the sense like, hey, I'm a doctor and you paid me, like under the table type payments. With that, obviously, it shakes the whole ground of the industry. What I dislike about it is that everybody, whenever a report like that comes out, everybody gets put in a bubble, right? Absolutely. So addiction treatment in general is just terrible people,
all corrupt,
which isn't fair, and then it only hurts the person that's looking for help. At the end of the day, what needs to happen is New Jersey needs to kick into gear. We need to do something. And what I would hate to see is insurance payers, the big insurance companies. So you got Blue Cross Blue Shield, United, and Aetna. They use that as an excuse not to pay anymore. Like, look, New Jersey's doing all the wrong things, so we're gonna slash the rates and kill everybody off, basically. They did that in Florida.
They did that in Florida, yeah.
Yeah, they did that
How
in
did
Florida.
That work? What they panicked.
So,
right?
They just ripped the rug out from everybody. So, like Blue Cross Blue Shield, for instance, I'll use that as the example. You used to get an affordable health care plan with a low deductible, and it would pay for a majority of your services, and you could have out of network. Now, if you get a Florida Blue policy, it's a $10,000 deductible, $27,000 out-of-pocket max. So 50% co-insurance for out-of-network.
So the guy that's addicted or the guy that's suffering from depression, the mental health, has to come up with $27,000.
Yeah, so they may as well not go to treatment. They might as well not have health insurance. Wow. And to run, the rate is so low that to run an in-network facility down there, it has to be massive. Like, you have to have 100 beds to make it make sense from a business model perspective. So what happens is then the quality of care goes down, right? Because I got to pack as many people on the building as I possibly can, and I got to increase caseloads on counselors, and so I don't have as much payroll. I'm going to get the cheapest counselor because I'm not going to get the high-end, world-renowned counselor because they're way too expensive for me to afford. So the quality of care goes down, and then what are you doing? You're running a puppy mill. That's what happens, where people are coming in and out in a cycle. So, that's the last thing I want to happen in New Jersey because it will kill the quality of care here. And where we actually got to a point in New Jersey where we have access and enough beds here to help people in New Jersey, right. A lot of those people are going to go out of business. They're not going to keep it afloat. So, I was suggesting that, maybe we, like a hospital opens, they need a certificate of need. Right? And that way they can open up in that town. Right now, that doesn't exist in the behavioral health space. You could just go, hey, I choose to open up here. Right? I think limiting the influx of people moving in here to provide treatment so there's not too much competition is one, and getting a better regulatory system. Because if I cap the number of licensed facilities I have here, then I can actually construct a team in New Jersey to regulate those properly. Instead of getting people from mosquito control and put them over in this department to regulate the 150 applications that I have in.
Government, one of the things that we've launched with the common sense platforms is that government doesn't make sense anymore. We don't have a government that is there running like a business or any kind of a well-executed plan. It is a government that is essentially a drop-off point for political donors.
Mm-hmm. Right.
I mean, that's what it's become. So, we're still seeing after the COVID lockdowns that a lot of the government doesn't show up to work, that you're still being bounced around. The calls I get, here we are, 2024, years later, still people fighting with unemployment, checks that never were delivered. Like, there's so much in the way of competence that has gone out the window, and it's because patronage drives it and not a metric of saying we have a goal. So I like the idea of limiting it like a license, like you have limits on liquor stores, et cetera. I mean, there's a way to do this, although the governor is running roughshod over that as well. They're going to devalue the value of all these liquor licenses by opening it up to unlimited. It's going to hurt a lot of these small mom and pop shops. And again, it's a guy that's never run a small business in his life making these decisions. So you got a bunch of academics that just got out of college, that got their first job, that, you know, mom or dad, a big donor, they get the job, and now they're in charge of deciding if you're running correctly. It doesn't make any sense. So I believe we need to I think, honestly, mental health should be a department of the executive branch. We need to address this in a very proactive way. We need to first change the way we administer Medicaid dollars, because there should be these dollars. I mean, 6.1 billion. Imagine if you could drop that to 5, have the requirements match the federal government, and then actually address with potentially with state money to get people the help that they need if it's not something that's going to be covered by the federal government. We're responsible for the money. We have a $56 billion budget. You're telling me there's not $100 million out there to focus on mental health? I mean, think about the cost. I was talking to maybe you and I were talking about this, but this has come up a few times, that for every dollar you spend on mental health, it's going to save you $2 down the road on social work.
Yes.
So, right. So think about you're now essentially subsidizing addiction. We're going to keep you addicted. We're going to keep your mental health. We're going to drug you up. And now you're a permanent patient. So nobody ever gets better. Look what they're doing with these kids with ADHD. Everybody's got it now. Now, all of a sudden, being a kid, running around, we used to call them just rambunctious kids, and you grow out of it. Now it's like, whoa, hold on a minute. Let's slow that down. Now what, you're giving a kid drugs at 9 years old? What do you think's going to happen to that kid when life turns in a different economic way for the family? All of a sudden, you can't get the drugs. We know exactly where that goes. The suicide rate. I had a call from the suicide hotline organizers in Mercer County. This was 2 years ago, right as we were coming out of the lockdown culture, which, by the way, New Jersey was the last to come around on that. We had everybody masked up and isolated and 6 feet. 6 feet.
Disaster.
They made that up, by the way. Even Fauci's admitted that. They made it up. There was no scientific basis, right? 6 feet. People will do it. What an insane experiment we went through. But not just the learning loss over 2 years, but the isolation and the suicide rate. They had a kid is 9 years old. 9 years old calling the suicide hotline. It's broken. It's broken, and I think it's a disservice that New Jersey has done to parents, because mom and dad are not necessarily equipped to be teacher, mental health counselor, provider. My God, the burden is on mom and dad to do an awful lot.
And they have to work full time and pay for it.
Sometimes 2 and 3 jobs just to afford to live in this state.
Yeah.
And the cost of health insurance for most people is completely out of control.
Oh,
So the system itself needs an overhaul, but I don't think you could begin to discuss an overhaul until you bring the stakeholders in. And that's why we're going to have our roundtable with the stakeholders in mental health and suicide prevention, addiction prevention, sober living. To me, you've got to bring all these folks together that have a personal and a financial interest in this, because I would like to see your organization, your company, your treatment center be wildly profitable, because what's going to happen is you're going to build more centers. Your model that you've built in Monmouth County could be duplicated in Bergen County, could be duplicated in Warren County, Somerset County, Middlesex County. To me, it's not regulation. I don't even like the word. I call it best practices. There
And
are
that's
best practices.
immediate fixes that can happen with the right
Immediate.
organization and leadership.
Let's say if we had a
Period.
governor
Yeah.
that understood the idea. I don't know.
That'd be nice.
Just saying. It would be nice, wouldn't it? That would be nice.
100%.
But think about what it would mean to have a governor in charge in this state in particular, because in New Jersey, with the 1947 Constitution, the governor of New Jersey has the most power of any governor around the country, all 50 governors. Why is it important? Well, because you've got a logjam in the legislature. The legislature was completely ineffective when Murphy ran roughshod over the Bill of Rights, when Murphy just decided we're going to keep the liquor stores open, but we're not going to allow you to have an AA meeting. Wait, okay, I understand keeping the liquor stores open. I understand that you've got people that are addicted, that you could create a real crisis. Fine. well, first of all, everyone should have been open, but that's another story.
Yeah.
But, how is it possible?
They're going to go that route, but not
Not
do
the
that
other route.
Yeah.
Insane.
Yeah. Well, I mean,
But the people in recovery shouldn't have a place to go.
look at the CDC earlier came out and said they have concluded that essentially COVID is flu. They're treated the same way. I'm like, oh, funny, because we told you that 3.5 years ago. But the reality is that government operates in a hypocritical way. So you're telling me it's okay to walk through a big box store, but not through a mom and pop shop. You're telling me that COVID's not going to hurt me if I've got to get my fix and buy my vodka, but then I can't go to my meeting, or I have to sit in a car. And I remember when the cars had to be 6 feet apart. Like, I mean, real madness.
We did it back in the day. Remember in COVID first? We did
I
a drive-in meeting.
Yeah.
It was like a drive-in theater, and they would have to stream Dan through their car radio. It was iconic, really.
Yes, well, but you adapted and overcame, and you're still here and you're stronger. But we need to elect a governor that understands that leadership in politics is about people and about ideas and implementing those ideas and making them practical so they're doable. I used to work. I'm still a broker with Jim Weichert. Jim Weichert, just a good friend of mine, and it's a great company. And his question after every regional VP meeting we would have, if somebody had an idea, it's like, that's a great idea. Is it doable? Is it doable? So you have to ask yourself, is it doable to require treatment for somebody that has just been administered Narcan from a cop? Yes, it's doable. And you want to know why? Because chances are they're using a drug that's listed as a class 1 narcotic with the federal government. They are breaking multiple laws at that moment. And guess what? We're not going to throw them in a jail cell.
Well,
We're going to partner with a group like yours and say, hey, we got a guy.
Right.
Needs help.
And same with the law that we've been advocating for since we've, been speaking with you, is the 5150, which is what, saved Dan's life in California. They literally he overdosed, they stripped him of his rights.
Yep.
10 days, right?
Yeah.
And that was enough time for him to stabilize.
And it's not permanent.
It's not permanent, but it does
Right.
enough to actually get them on the right track.
Yeah, I was not in the right mind. I was never going to choose recovery in that moment. You know what I mean? That I had to be forced. And thank God, because I'm here today, and thank God because my mom got to sleep that night, not very well, but she knew I was somewhere safe, if I wasn't forced into treatment right then, she would have lost her mind. Yeah.
And think about the parents today that they're happy when their kid gets caught in because they think, okay, maybe they're going to get help.
Well, they're exhausted.
But you got a drunk driver, well, he's going to be held,
Yeah.
right? But you're telling me I can overdose and not be held. And I think the stigma that we've really put out there is that somehow government intervention is always bad. I want to remove the stigma from government. Government should be working for us. Right now, government works against us. People complain all the time, and I hear it. I get calls all the time about the curriculum in our public schools. And a lot of conservatives say, we ought to get rid of the Department of Education. Like, blowing things up is not the answer. You gotta. If you're gonna blow something up, you better be prepared to rebuild it better.
Right.
And actually rebuild it better. I hate that I said it. It sounds like build back better or whatever Biden's thing is. But it's not political. It's that. Why don't we have teachers holding positions at the Department of Education? Why don't we have school counselors and school nurses and people that are interacting with kids all the time, giving their expert opinion? Why is there not a department set aside for mental health, which has regular meetings and advises on legislation that will actually help? What will really help? And I think the problem is that they opened the floodgate and everybody came in. The real profiteering was, let's make money, get money from the government, and we have no accountability to deliver a service. That's the problem.
Well, it's been it's been monopolized, like you were saying before. Everything in the behavioral healthcare space is starting to move that way. Any kind of facilities that are able to take Medicaid are typically ones that are connected to some kind of political sense. And the reason that is because the average cost per client for our treatment centers costs me $350 a day to treat you. That's cost. That's overhead, everything like that. Medicaid only pays $70. So how am I supposed to do that? I can't do it. It doesn't make any sense. These other facilities can, and the reason why is because they get a lot of grant funding in that subsidize those costs for them. But me, little old Daniel, can't go. I have no idea who I talked to get that, to get those grants, and nor would they ever give it to me. So like
you don't have the lobbying firms,
Correct.
the big lawyers, and
so
that's
that
the
becomes
problem. Yes.
becomes monopolized. Even in our drug testing, did you know that the only companies that can get in-network contracts are LabCorp and what's the other one?
Even?
No, it starts with a G. LabCorp and
I know what you're talking about.
yeah, I can't remember the word of it.
But I know what
There's
you're
only 2 labs in all of America that could go in-network insurances. 2.
It's outrageous.
That's crazy.
So we need to fix it. I am passionate about fixing it. I think that it cuts to the core of what families are struggling with. You've got economic struggles. You've got mental health struggles. Government is not working for us, and we're paying an awful lot for it.
Yeah.
We're paying almost $60 billion a year for the state government at Trenton. What are we getting for it? What are we getting for it? So change is coming for sure.
Awesome. And I think that like just getting it out in the forefront of ways that we can change it immediately. It's not like this is a 10-year project. Right. It is. It's for ongoing, but there are immediate actions that could take place that would transform it.
Imagine if we just ended the sanctuary state status in New Jersey and dealt with the fact that we have had an influx of hundreds of thousands of people that are now using resources that are not being made available to groups like yours. That's, we don't even know what the number is. The governor won't tell anybody. We have I don't think they may not know, but it could be 800,000-900,000 people. How many of those Medicaid dollars are going to people who are here illegally? Right. And it's not like you don't want to strip it of the human issue of, hey, everybody deserves a break and you want to help everybody. We absolutely have to start triaging how our money is going to be spent in this state. Yeah. So you end the sanctuary state, you end things, you reverse what they've done with bail reform, even bail reform. You're letting young criminals out back on the street. Well, how are they ever going to learn what they did was wrong? You got these 20-somethings, they get arrested for stealing a car, then they're told their trial's not going to be for 2 years, but we can't hold you, so you're out. What are you doing?
Maybe turn the jails into a rehab.
Well, what
if
we partnered with the jail? Right. What if the county jails were able to partner with groups like yours? And if you were using, I've said this. I said if we went back and enforced all the federal detainer orders of illegals that are here, you could actually have a cash flow going from the federal government to our county lockups. That's what we were doing before, but they shut that off when they virtue signaling on this border issue. Now the county's lost the cash. Some jails have closed, and there isn't enough money to go around to then help people because we've got too many lawyers, too many engineers. I mean, look at the cost of road construction. They estimate it's between $1 and $2 million a mile. How's that possible? How is it possible? And let me tell you, it's not the guys swinging the hammer that are taking that money. Right. It's the lawyers and the engineers and the consulting firms that are getting that money. So I can't even imagine if we peel that back in the mental health space, how much money is wasted and never gets to the patient.
No.
Yeah, I mean, I correct me if I'm wrong, but I don't think the state's even ever sent like any sort of survey to you or our clinical directors or medical team of like, hey, how's this going? What are some suggestions? They don't care. And that's the problem because they're setting it up without the knowledge and they don't care. Yeah.
SAMHSA does, which is our government. They get, it doesn't really say much on it, but yeah, SAMHSA is the only one that has ever asked questions. But they, it's funny that you say that they switched where the money was going with recidivism because all the grant funding changed from addiction related to recidivism related.
Yeah.
It's crazy.
So everybody who got their, chops cut with that change got it back on the in a different way.
Right. It's like a Times Square shell game. We're just moving it around.
So we got a lot of work to do, Bill.
We got a lot of work, and this is the first, I'm sure, of many conversations.
Hope so.
Bill, as always, thank you for coming out and joining us.
You're
And
the best.
we look forward to chatting more.
Appreciate it.
Thanks,
Awesome.
guys.
Thanks.